we're good to go.
All right, go ahead and take it away, Gary.
Executive Director Onion, welcome back, everyone. I'll say our next guest needs no introduction, but give her an introduction. Nicole Krishnaswamy, Executive Director from the Medical Board, was kind enough to cross the bridge and come over and share some of her experiences revolving around her the development of and implementation of their strategic plan at the Medical Board. I'll allow Nicole to introduce herself, but one last thing, I just want to say how much I appreciated the support from both Nicole at OMB and Rachel Prizak from OSBN, especially during the height of the COVID madness that we experienced. They gave me a lot of support, and it was nice knowing that I had some seasoned veterans in my corner when we had so much that was expected of us and that hinged upon our actions in this small little agency. So I appreciate that partnership and the growing relationships that we have, because if you think about it, our licensees and their work are so intimately intertwined between nurses, physicians, and pharmacists. So it just makes sense that those boards should have a close relationship. So I appreciate the relationship and support and all through the city.
Thank you, Gary. That was very, very kind. I'm so happy to have Gary on board. Rachel, Gary, and I are sort of locking arms and walking into legislative session at the governor's office, and it's been really powerful, meaningful partnership with the three boards. So looking forward to it. Very pleased to be invited to join you all today. As Gary said, my name is Nicole Krishnaswamy. I'm the Executive Director for the Oregon Medical Board. I've been the Executive Director there since 2018. And before that was in a role similar to Bree's, doing our policy work, legislative analysis since 2010. So I've been around a little while, but very excited to have Gary joining us in this role as a colleague. So I was asked to just kind of give you our experience with our strategic plan and what that looks like. We have had a strategic plan since the late 90s. So we've been doing it for a while, and our cycle is to do it every 2 years. We do an update. It has evolved over time. In the 90s, I believe we hired a consultant to come in and facilitate how we were doing our strategic planning. We had mixed results, I would say, with that. The consultant, we didn't feel knew us as intimately as we as a staff and board knew ourselves. So it was helpful, particularly to do an environmental scan, understand what external forces may be coming around the practice of medicine, and get that sort of baseline understanding. But once we had that work done, we've started to move away from having a facilitator help us with our strategic planning. We now do it internally, as mostly our management team gathers to review our strategic plan. And we've got a pretty small management team. We have a medical director who's our only medical professional on staff. I guess let me pause for just a moment and say we license 27,000 individuals. It's MDs and DOs, podiatrists, PAs, and acupuncturists. And we don't do facilities, and we don't do inspections, we don't do businesses. So those are our 27,000 licensees. We have 42 staff members on site, only one medical professional. I'm a JD by education and training, but only one medical professional. So our medical director and myself, and then our operations and policy analyst, our licensing manager, and our investigations manager, and then our business manager comprise our management team. And those individuals sit down over several sessions to review our existing strategic plan and then decide if there are updates that are needed. So Rachel, could you show our current strategic plan? This one covers 2024 to 2026. And so that means we're due for an update, and we'll be starting that work in the coming month or so, where we gather together. So our strategic plan has 6 primary goals. And I think if you can scroll down, Rachel, there will be a table of contents. So we start out by talking about our board's mission and our vision, which we just created our vision statement in 2024. So that's pretty new for us. I think if you scroll down a little bit further, Yeah, there you go. We have a statement about our commitment to equity, and then we have identified 5 core values that we carry as an agency: integrity, accountability, excellence, customer service, and equity. And we have integrated those core values throughout our strategic plan. So those are really important to us in developing what our 6 main goals are and our strategies for how we will achieve those goals. So then if you scroll down, this sort of gives you a background about when our first strategic plan began in 1999, and then what we have been doing since that time. And that's pretty much the only background information that we include. We have decided not to continue including the environmental scan in our strategic plan itself. We talk about those things when we develop the strategic plan, but we have not included it. And when we do our environmental scan, we're talking about things like AI and electronic health records and team-based care and all of those things. So there's robust conversation about the environmental scan, and we have a worksheet that we use to go through what our risks and challenges and opportunities are. But all of that background work informs this document. It doesn't go into this document. So if you scroll down further, I think this is just more introduction about how we go about that, pretty much saying the same things I just said. So this is our first goal, and we've decided to remove the numbers next to our goals. I say we have 6, but it was really difficult to say that one was more important than the other, so we intentionally have removed number 1, provide optimal staffing. And so it's just provide optimal staffing as our first goal, and we describe why that goal is important to us. And you can see we've included our core values in that description. And then we go down and strategize how we're actually going to achieve that goal of providing optimal staffing. And so we talk about, okay, well, we need to focus on attracting and retaining the highest quality staff. We're going to focus on pay equity. We're going to complete our performance accountability feedback check-ins. Those happen quarterly. So I won't go through all of them. You're capable of reading them. But these are our strategies that help us achieve that overarching goal of providing optimal staffing and resources. These are still pretty high level, though, when you look at deliver agency-wide trainings to meet evolving needs. Well, what trainings? What does that mean? And that is in a separate document that I will show you in just a moment after we finish going through the strategic plan. So our first one was provide optimal staffing, and then our strategies. And then the next one, oh, the actions are on here, actually. And we also have a separate document that is kind of our internal working document. But these actions do provide you, we like to think of them as SMART goals. So if you're familiar with that acronym, and I could not rattle it off to you right now if I put myself on the spot. But these are SMART goals, so they are specific, they're measurable, they are attainable, and we have who's responsible and the due date for them. And these are critically important because it's great to have a strategic plan, but if you're not making actions to fulfill those goals, then you just find yourself in a stasis. So we have these action items that come out of that management team that sits down and really goes through like, okay, how are we going to do this? What do we want to achieve in these 2 years? And we're really deliberate about them, and we come back and we revisit them. This goal really falls under our HR and our business manager. So the 2 of them will also have an offline conversation, really digging into this, and then bringing their suggestions back to the management team to talk about, okay, here's what we're thinking, and then we continue refining those things and put them in. I will say, though, that this is not a meeting time that we do all of this work. It happens throughout the year because as new ideas come up, as a piece of legislation passes, we are constantly adding to our sort of running file folder of things that need to go onto our next strategic plan. So that when we get to those planning sessions, we've got a file of things that we've got to do, we've got to focus on. And so those all start getting integrated into this strategic plan. So that's the first one, and I'll just quickly run through the other 5 so you see which ones we've chosen. So attract and retain the highest qualified board members and consultants. We cannot do our work as an agency without all of you, of course, and we need to make sure that we've got really engaged board members who care about this work, who are driven by the mission. So we spend a lot of our efforts on recruiting and retaining our board members and then supporting you all to be as successful as possible. We know that you're donating your time to do this. There is no compensation that is adequate for what you do. And so our job as staff is to make sure that we are making this as easy and as straightforward for all of you so that you can come in and make the important decisions at the end of the day. So that goal is critically important to us, and we've got strategies about how we go about that. And then you'll see we've got our action items under there as well. I'll say that we've got this pretty well tuned right now, knock on wood. So you don't see as many action items under this goal because it's kind of already functioning really high level. So then if you keep going, we have added in some of these little asides about what board service means because it is so important, and sort of the things that I just went through with you about the importance of having good quality board members and what their role is. Then our third goal is to efficiently manage licensure. We know that that's the pressure that we get from legislators, the governor's office, our healthcare institutions who want somebody yesterday, all of those pieces. So we want to make sure that we keep this goal at the top of mind, that we are constantly working to become even more efficient. And so then we've got action items under those strategies as well. And then our fourth one is to thoroughly and equitably review complaints against licensees and applicants. We had a Secretary of State audit recently that identified some areas for improvement for us around making sure that we're consistent in our disciplinary outcomes. So a lot of our action items then will flow from that. So again, this is where these action items are coming from, or as we hear things from our board members or the community, constantly adding in things that we can be looking at doing better. I'm happy to say that we have been meeting all of our due dates and everything. Our online web form has just recently gone live. So it's a nice reminder to look back at all of this and see that these are really happening. And again, this is just something that we've inserted to sort of add some context to our strategic plan about how our complaint and investigation process goes. And then we've got to support the health and well-being of OMB providers. This really focuses on the HPSP program, the Oregon Wellness Program, which is confidential free counseling. Paul, does Pharmacy Board participate in the wellness program? If you don't know, then it's probably no, because we put $280,000 per biennium into this fund. So if you're not already participating, then that's what that is all about. But it offers our licensees can call into a statewide number or reach a statewide website and be connected with a mental health provider within 72 hours. I know the nursing board recently joined, so if that's something that you'd like more information on, we can help out. So that's about keeping our licensees well, because we know they can't provide great patient care if they themselves are not well. So that's why this is part of our strategic plan. Yeah, that's sort of talking about our philosophy around the importance of wellness. And then this is our last one, and that's to increase our outreach and education. So we want an informed public. Sometimes that's the hardest one to achieve. I think there's still a significant swath of the public that does not know that licensing boards exist or how to access our services. So we want to continuously remember this as one of our goals. So that is our strategic plan. Quick overview of it. And then Rachel, are you able to share the Excel sheet?
Yes. Just a moment.
So every quarter, that same management team gets together and we go through this Excel spreadsheet. This is those action items that you just saw in the strategic plan, but they're broken out into kind of a working document. So these are the same action items, the same due dates, and then we have our completion date, and then we, of course, have our responsible parties, and then any notes. So you know, we pat ourselves on the back. You see, amazingly successful. Right? And I mean, I don't think we do that sort of thing enough. We don't celebrate our wins enough. So it's nice that my assistant Gretchen will do that stuff. And every once in a while, there is one that we do remove. So that's going to be those dashes. So the core business suite software we had, as you know, one does, we had a failed IT project. So that has now been removed from our action items. But these things get updated in real time. We set aside about 90 minutes to go through this document every quarter as a management team to make sure that we're on track. We will make modifications if we have to, but we're really focused on holding each other accountable. So if your name is in the responsible parties column and you haven't done anything and that deadline is inching up, then we as a management team will say, what do you need? How can we help you? How can we support you? You know, what's the projection on this? And we kind of keep it within eyesight so that we don't forget about these things that we've said we're going to accomplish. And that's broken out in the same ways under each goal and then each action item. So that is how we do our strategic planning. We do have, is there?
Oh, I was, yeah.
Yes, of course.
Not a stammer moment. I was just curious if did you integrate the governor's strategic initiatives? Are these kind of sprinkled throughout this as well?
They are.
Just okay.
Yes.
I just want to make sure.
They are. There are, we also have a separate IT strategic plan. So, you know, there are some different documents. This is not the be all end all. It doesn't have everything. I think, for example, the governor's, one of her expectations is that we have a succession plan in place. I believe that's in here. If it's not, it's because we're monitoring it somewhere else, but it probably ought to be in here. And that actually may have come out after this document came out. So there may be some timing issues. But I know earlier we talked about the performance accountability feedback that is in this document. So there's quite a bit of overlap. And you can see our color coding. If it's blue, that's one that we're going to focus on. And then if it's gray, we've completed it. So that's just kind of our visual to make sure that we're keeping on track. What I didn't talk about in this whole process is where the board is involved. And I didn't do that intentionally. So I want to circle back to that part. The management team does the grunt work in getting this document put together. And then we do take it to our board. We have committees that review things first and then make a recommendation to the board. So it goes to our policy committee, which is a subcommittee of our board. There's 5 board members on that. Our total board is 14 board members. So 5 board members are on our policy committee. They do a deep dive into these documents and will make tweaks if they need to. And then they will vote to adopt the final document at our full board meeting. And that happens in the spring. So that's why we'll be starting our work in December to get the 2026-28 version ready to go so that they can vote on it at our April board meeting. The thing that we are going to be doing more of going forward, and it comes from the governor's expectations and the last time that they reviewed our strategic plan, is that we do some consultation with our associations and our partner organizations, but we really send it to them and say, hey, here's our draft strategic plan. Do you have any feedback? And most of the time we don't get a response, or they'll just say, thank you, received. And so we haven't had true engagement with our partner organizations. We're going to be trying to amplify that a bit more and see if we can really draw them in to get their participation in the process a bit more. So we're going to be very intentional about that. And that's definitely an area of improvement for us. But that's sort of all my thoughts on our strategic plan, but I'd love to answer any questions that you have.
Just about Board President Joyce, I'll probably go around. I'll go ahead and just start first. First of all, I love it. It's clear. You have your measurable metrics. You have your due dates. It's malleable. It's not static. Like ours seems static. Yeah, I mean, there's objectivity. You have accountability. You literally put the names of people who are responsible for certain tasks, and so that's good. So yeah, it's great. I also like the duration of a 2-year window, and like I said, the malleability of it, the continuous updating of it is fantastic, and I wish yeah, we could go that direction. Board Vice President Kirkbride. Any questions or comments?
I did kind of catch one comment that I made a note about that I want to talk about later, which was the offboarding of board members and then like re-engaging them. I thought that was a fantastic idea, and like how we can incorporate that. I love that. Other than that, no other comments.
Board Member Smith.
Oh, you're on mute, Brian. Sorry.
Sorry, Board Member Smith, no further comments at this time.
Board Member Patel. Questions or comments?
Board Member Patel, no comments. Thank you.
Board Member Kroger.
Board Member Kroger, really appreciate having our friends at the medical board come in and talk a little bit to us. I thought what was really interesting, it felt very focused internally, like what can the board and the board staff do to impact things, where I feel like maybe, as Gary had pointed out in the previous strategic plan, there was a lot of like external factors and things that they were looking at strategically that was not necessarily within the purview or control of the agency. And I think the medical board did a great job of really focusing on what they can do to make positive changes, and really appreciate them going through that. So thank you.
Pinedo.
Board Member Pinedo, yeah, I really appreciate seeing someone else's strategic plan, being new to the whole process and not really being familiar with what a good, solid strategic plan looks like, and to have something to compare and kind of see a cleaner, more not so messy version of it. I do appreciate it, and I respect everything you guys do over at the medical board, and it's great to just we are all one in a way, you know. So I love the fact that we're able to work with you and for you to show us that this is another option of what it looks like, and I do appreciate it. Thank you.
Very good. Board Member Chen.
Hi. I think my observation was, number one, thank you. And I really liked the process and as you stated it, but it was really fascinating to me that it was primarily driven by board staff, and then a subset of the board really doing the deep dive into what the board staff had created. And I think that's a way different concept than what I've been involved in on this board and the previous board. And that's an interesting idea to keep in the back of my head about how we move forward with doing our strategic planning. And thank you.
echo what everyone else has said. I agree that it's a big difference. It's a lot cleaner, and the idea of including the staff to how that we are starting, starting from here where we're at, but it's, it's a step in the right direction. So thank you for that. That's really nice.
Executive Director.
Thanks again, Nicole. I appreciate the context and understanding of from its infancy to what it is now, how it's developed, and your role and staff's role, and coalesces with board action and directives. I do have one question about whether or not you have any pearls of wisdom, like pitfalls to avoid, as you've had such an extensive experience with strategic plans, and I'm sure some of them were great, and then some of them, maybe had components. I'm assuming here didn't work out so well. Can you speak to that, like any pitfalls to avoid, or things that you thought would work out well, but upon implementation, just kind of that gap?
Yeah, I think when we use a facilitator, so we didn't use a consultant to sort of do the work for us. We had a facilitator who came in and worked with that same management team. And what we found was that it was very off-putting to our staff to have somebody come in who didn't know our names, didn't really know the work and understand the work. And we felt like we spent a lot of time educating that person instead of focusing on the efficient use of everyone's time. And we all know this work better than anybody else, right? And so getting down to business and identifying the risks was really critical for our staff. Since we've no longer been using a facilitator to do that work, it has gone much better. People are look forward to our strategic planning, where it used to be something they dreaded, like from the pit of your stomach dread. So it's gotten much better. I found a worksheet online about how to have a strategic planning meeting, and it's colorful, and it's like a little worksheet that we can go through. And I ask everyone to look at that ahead of time and sort of brainstorm offline, so that when we come together, we can have a really fruitful discussion, and we're not kind of starting from scratch. So I think showing our team respect and that they have really good, powerful ideas for how to make this work better has really improved our process.
Thank you for coming in and sharing that with us. It's there's some big differences between ours and yours, and I look forward to the direction we'll likely be going with ours. And thank you so much. Appreciate that. Is there anything else?
No, as far as I'm concerned.
Go on to discussion.
A few slides left
Yeah.
there.
Thank you so much.
Yeah, thank you. I'm happy to answer any other questions as they come up. We're in frequent contact, so anytime if any board members would like to chat to them.
Thank you, Nicole.
Within reason.
Just a moment back to.
Okay. Thank you.
Okay, we are back on slide 34 is what I had written down. Is it's correct?
You are correct.
Okay.
All right, Executive Director run-in. We'll kind of speed through the last couple pillars as you'll notice, common themes between the content and what we've already covered. So I won't belabor those points because they're parallel to points that we've already made. In terms of slide 34 here, not really much to add. I think, again, we've made significant progress with most of this, thinking back to that policy topic redistribution or rules ranking presentation in February, the follow-up in April, and all the meetings subsequent to that. The one thing I would point out is under number 4, key actions, again, continuously monitor the impact of newly adopted rules. What are the measures of impact? What does that look like? What does it mean to continuously monitor something? What are the expectations there? So again, just other points for your own curiosity as we look forward to how we want our plan to evolve in a more objective and actionable way. Next slide. Key actions number 1, identify patterns and potential root causes of regulation violations. Actually, we already do this as part of the board report. And again, as I mentioned at the beginning of the presentation, I think this relates to SDA. And we'll have and continue those conversations at the December meeting. And I also mentioned too that there is intent on my part when resources allow and timing allows to hire attempt to execute to some degree retrospective analysis to identify those trends, and which would serve as a primer to the creation of a disciplinary grid, whatever that would look like. And next slide. Same song and dance here, not much to add. That we'll go to the next slide. And then the last pillar is communication. I've done a significant amount of work here, not only as a pharmacist consultant, but as the ED. I think it's pivotal for me to be out in the community, shaking hands and hearing stories from interested parties, getting that candid feedback, developing those relationships, and increasing engagement through those processes. It's one of the things I appreciated about the consultant position was that ability to grow those relationships and be out in the public and present. And I've continued that during my time as ED. I think I've mentioned also from the communications piece and the OSPA Pharmacy Coalition I presented at, and then also at the most recent board meeting, where I think there are opportunities for us to strategically partner with the interested parties, including but not limited to other agencies and associations, to increase the scope, the reach, and impact of our communications. And I think that was highlighted by the COVID crisis, if you will, that we went through, and there were just opportunities for increased communication, and I'm exploring how we can go about that. I know the last time I presented that Dan Kennedy mentioned that, whenever I'm ready to talk about revitalizing the pharmacy roundtables, that, he's open and willing to do that. I think we still have a few pieces in place to put in place rather before we're able to do that. We need some additional staffing, and it's a busy time of year for us, but very soon, I look to revitalize that as part of our armamentarium, if you will, to increase the scope, reach, and impact of our communications in alignment with the strategic plan. Next slide. And promote awareness and knowledge of rule changes and other board action to support understanding and compliance. And the key actions there, a lot of those we already satisfy. We don't routinely report on them, but you routinely receive evidence of these because surrounding any significant board action or any rule filing, et cetera, we'll send out an eGov blast. So that's often pre and post launch. So we're already doing this in a lot of ways. And in terms of inbound communication channels, we already satisfy that arguably with our online forms. The compliance officer that's on phone duty, you have a few different resource boxes depending on the nature of the either complaint the comment, feedback, inquiry, etc. And it'll be routed to different departments, if you will. So we already have those kind of implemented in our standard processes and procedures. Go to the next one. And the only thing I'll point out here is you heard Nicole mention that they get together quarterly to evaluate their incremental progress on the strategic plan implementation. Of note, as far as the governor's concerned, there is an annual report that's due on the status update and implementation of the progress. And here it looks like for the strategic plan, there is simply a yearly progress update as well. I do appreciate being able to incorporate some of the updates in the bi-monthly report and also giving them to the board at the bi-monthly meeting. And I think that makes sense and increases the transparency and engagement from and with you all, and which will help continue to build trust. And I appreciate those incremental opportunities to receive feedback as well. So even though it's only required to be reported once a year, I continue to foresee implementing those in the board report at the bi-monthly meeting. I think it's instrumental for me to ensure that we're on track. And also, as Nicole said, we don't do a good enough job of telling our story. Bree said that several times as well. So if you look at the board report that I sent out yesterday, maybe I took that to an extreme. I didn't tell you everything I've been doing, but if you wondered what we've been doing behind the scenes, there you have it. I think it's a great opportunity to talk about those wins and talk about the challenges as well. And I opened that up to the licensing director, Hennigan, and the compliance director, Effermoff, saying, hey, the next report that goes out, tell me about those wins that you have with your staff. Tell me about the good work that you're doing. Tell me about those things that you're proud of, those accomplishments, et cetera, because I want to share that because I'm so proud to work with such an esteemed and dedicated group of people. And I want everyone to know that, including our interested parties and licensees, registrants, et cetera. Go to the next slide. Again, won't belabor the points here. Parallel considerations as compared to previous slides. This could benefit, for example, from explicit incremental markers, objective goals, timelines, et cetera. And then I hope at least someone's seen Dodgeball here. So it wouldn't be a Gary Running presentation without a little bit of humor, right? Professionally placed, this discriminately placed. So let's talk about the 5 S's of strategic planning, which I just made up this morning. So we want to simplify the plan, right? We want to subsume. Had a struggle finding an S word for that. And what I mean by that is, there are companion plans like the DEIB plan, the IT strategic plan, the continuity of operations plan, succession plan, et cetera, that we can incorporate into the strategic plan, as you heard Nicole mention as well. And then scale. So again, let's put the account in accountability. Let's make sure that we're aware of what we're expected to do, and that'll give way to problem solving to identify how we can do it. We want to show, so we want to report not only to the board, but as one of the governor's requirements, there's a transparency component to it, where they want those results posted on the website or on the dashboard. We do post all the required information on the website. I think further down the road, post software modernization, if we get an operating software platform that will allow us to more readily pull that information in a succinct way and present it in a succinct way like they do at DAS, which you can see on their website, then I'd like to do that. I would like to do that so that licensees, registrants, and interested parties don't have to go to multiple places on the website to see all of the strategic plan progress that we're making. Again, that's contingent upon updating our software. And then simplify, of course, if you've seen Dodgeball, they repeat a few of those. But I can't say simplify enough. So And then moving forward, I won't spend too much time on this, but in looking at our strategic plan, looking at the strategic plan of other agencies, not only Medical Board and State Board of Nursing, but DAS, Energy Board, et cetera. Here are some opportunities I think that we can put in our back pocket or keep in the back of our minds as we continue to explore the potential for revising, this plan into our next iteration. Opportunity one would be to include additional mandates, KPMs, and perhaps budgetary markers or decisions in there. We have all of the employment metrics that I mentioned, the quarterly performance feedbacks, the training. And it would be interesting to see the board input as to what you want more information on and reported and what you consider markers of successful operations here at the agency level. Number two would be accountability. Again, put the accountability and make sure that those requirements are well defined and well assigned, that they're not nebulous. Because again, if no one understands it, no one owns it, then it's not going to get done. I don't think we're at a point, or any agencies at the point where people are just looking for things to do and would just randomly say, oh, I think I'll look at the strategic plan and see what needs to be done today. And it doesn't happen like that. So we have an obligation to make sure that we communicate those expectations and that we equip employees to satisfy those expectations. And then number three, vague timelines, which you heard me mention. The timelines, if you will, in those executing the plan sections are multi-year bars. So they're more durations than deadlines. And they don't hold us accountable essentially for reporting at any incremental cadence or interval. So I think, again, that's important. Going back to the analogy of driving to Tennessee and, checking the roadmap at least a few times, or I guess people use Waze now, use a map, whatever you're using, you need to check it more than once until you get to your destination. So go to the next slide there. So how could we improve? Adopting a new structure modeled by sister agencies or partner agencies. Every goal in our next plan, in my opinion, should have a clear initiative. In other words, the what, a responsible team. In other words, the who, and a specific due date, the when. And one thing I will say as far as assigning a responsible team, we had several, attempts or installments of meetings dedicated to that. We're using Smartsheet to do it. But the plan itself is so large that by the time you assign someone that's responsible and then another person or a set of people that are responsible to follow up with them, that it just became a little overwhelming to look at and then implement. So I think that assigning a responsible team is going to be a pivotal kind of derivative of simplification, or the overall simplification of the plan. You saw how nice, clean, succinct the Oregon Medical Board's plan was, where there was one person, position, or team that was clearly identified. And I think with the simplification of our plan, it would be a lot easier to do that. And then how we track progress. Well, there's internal and external tracking and presentation. So I'll facilitate quarterly reviews, and similar to what Nicole mentioned with her team, to check progress on every single action item. And then externally, hopefully once the new software program goes live, we'll explore the possibility of creating a strategic plan dashboard on our website, again, to increase the transparency of what we do, thereby building public trust and showing progress, not just talking about it. And then last. So I think we have a solid foundation. There's a lot of work that went into that, but I think it's time that we evolve. I think our next plan should be a true management tool that drives action, ensures accountability, and builds public trust. And for me, what do the metrics of success look like? For staff, it'd be clarity. I want staff to know what's expected of them, when, why, how, all of the W's there, and then have the resources they need and the time with me or the support from other individuals that they need to accomplish that. Nothing should be a surprise. You've heard me say that before. And it goes back to the communications piece. Like nothing the board does should be a surprise. And there are a lot of outlets for interested parties to stay in tune with what we do and see the why behind it. And that's important for our staff too, to understand why we're asking certain things. And that's one thing that I've made a commitment to as far as they're concerned. Like I will always tell you why I'm doing something if I can. And if I can't, I'll be honest that I can't. And provide you still with enough support and resources you need to do what we're asking. In terms of the board, governance comes to mind. So with a newly implemented and revised plan, the board will be able to effectively direct and govern the agency by monitoring clear and measurable progress. So this is a plea for this plan for me to be more accountable to you, right? Which is I think what every board would want, right? An executive director that says, hey, tell me what you want done and I'll do it. I'll report to you. You know, how can I be, as Nicole mentioned, how can we be in the agency instruments for you to equip you to do the job that you need to make those important decisions and for you to know that the decisions that you do make in terms of your directives and how they affect the agency are being implemented and are being carried out and are at the forefront of our operations and are important for what we do. And then lastly, for the public, accountability and trust. I think through that dashboard and through increased reporting, we can transparently demonstrate that we're responsible stewards of public funds and are effectively meeting our statutory obligation to protect public health and safety. And with that, I think I'll turn it over to President Joyce for board discussion. That's all I have in terms of the presentation.
All righty, thank you for that. Vice President Kirkbride, did I start with you last time or were you second?
Yes, you did start with me last time.
Okay, so Board Member Smith, go ahead, please. Any comments regarding what we talked about today?
Yeah, Board Member Smith here. You know, I think much like there's a lot that goes on in the pharmacy that people aren't always aware of. You know, like I hear the comment like, what takes so long? You're just taking pills from one bottle and putting them into another bottle. But there's a lot that's going on back in the pharmacy, and just like the board staff, I think it'd be really great for the public to be aware of what all the board is working on. It's been really eye-opening for me being a new board member, seeing all that you guys do, and it's great work, and I would love the public to be aware of that. I think it just transparency is great, and yeah, so that's all I have. Thanks.
Thank you. Board Member Patel.
Board Member Patel, no comments. Thank you.
Board Member Kroger.
Board Member Kroger, no real comments. Just thank you, Gary, for the thoughtful presentation, and I think we're on the right path of revamping the strategic plan. So nothing further to add at this time, but just a huge thank you for the thought and work put into where we're at right now.
Board Member Pinedo.
Board Member Pinedo, not a lot to add. I do look forward to the changes that are going to come if we so decide, as far as the strategic plan and making things less muddy, as I've said, or less messy. I do appreciate Gary and board staff for relooking at all of this and giving us an opportunity to make it better, because transparency for licensees and with the new website and everything that's coming through, clarity is a big thing. And I've said it a million times, and I'll probably say it a million more. Like, it needs to be black and white. Like, it needs to be easier for licensees and anybody to just pick it up and say, okay, I get what this means. A lot of people can't with a lot of the things that happen, and it makes it difficult as a licensee to understand what's going on.
Board Member Chen.
Board Member Chin, I don't have anything to add, but would echo Board Member Kroger's comments and gratitude for Executive Director Runyon's leadership on this. I think we're headed in the right direction.
Board Member Hall.
Nothing to add, but yeah, just echoing, thank you for all the thought put into this and hopeful for the future. So good.
For President Joyce, yeah, thank you, Gary. I appreciate your deep dive and how you laid this out, and I ripped it apart. Our strategic plan. I love what the OMB showed us today. It had clarity. The due dates were, and then the accountability, all of that impressed me. And I would like to see in the future a much shorter time window rather than the 5-year plan. But we'll talk about that later. Yeah, I mean, effective regulation, that's part of our mission. I want to make sure that's in the strategic plan in the future. You know, part of the thing with this strategic plan that we developed, it was kind of post-COVID. We were still in that post-COVID hangover, so to speak. So there was the factors in there about job satisfaction. I think that kind of dealt with like staffing issues and also the things that were going on with PBMs and all the pharmacy closures. But it was a pretty tumultuous time, and we were, you know, creating the strategic plan that kind of wanted to look at, you know, job satisfaction and mental health. But like I said, that's more related to staffing issues and things like that. So yeah, I look forward to our future discussions on this, having more clear measurable metrics in our plan going forward, and strategic and SDAs. I'm looking forward to discussion SDAs because, you know, ideally I want the Board of Pharmacy to be this well-oiled machine. So, Board Member Kirkbride.
Board Member Kirkbride, yeah, I wholeheartedly agree with Executive Director Runyon's identified 3 opportunities. I've often felt like a little bit of dread when I see a strategic plan on the agenda, because I feel like it reads like a magazine. It's very static. I've never felt like I could engage with it as a board member, and it's just like a listening session. And so I think looking at it in a different way and using the Oregon Medical Board as an example, one of the things that struck me as she was going through it, it was like, oh, she's done. It's shorter. It's more simple. I think we can take a lot of direction from that, and I think just making it more dynamic in a way that we can engage with it and have it be more of a living document will be really beneficial. So thank you for this opportunity and exercise. I'm really excited to move forward.
Thank you. Do you have anything else on the agenda for us, or any other additional comments before we? Oh yeah, I'm sorry.
No, I just wanted to say that I think it's really beautiful, because I've been here 11 years, to kind of see the transition and to also maybe pay the respect to all of the other strategic plans before, to honor the work that has led us to be able to do this. Having those discussions created the rules prioritization list, which now takes that out of having to be in a strategic plan and doing the work back in board meetings in a way that is thoughtful, that is transparent, that is more collaborative. So I think a lot of the foundational work from previous board members and board members that are currently here really led to this opportunity. So not to forget that also. I think that was just important. So thank you to all of those that came before.
Good, absolutely. Mary, anything else for us before we adjourn the meeting? Any additional comments from anyone? No?
I have 2 comments. Number one, as always, thank you all for showing up this morning and listening to me and entertaining my rather quirky sense of humor at times. But I appreciate all the feedback, and you know, I take that feedback and look at ways that I can be better at what I do, to better serve you and better serve our Oregonians. And then the last thing I'll say, I will look into the Oregon Wellness Program. I appreciate that comment. And that also coalesces with the governor's priorities and initiatives. So I'll take a closer look at that and be in talks with Nicole as needed to figure out what that might look like for us. It seems like a worthwhile investment, a way for us to further support the licensees that we serve. So.
Yeah, that's a great point, Gary. Mental health. We were all kind of in a daze during those years, and looking into the wellness program that would help to address that. Well, all right. So, seeing no other additional questions or comments, is there a motion to adjourn this meeting at 11:10 p.m.?
Yeah.
I'm sorry. My goodness. It's not 11:10 p.m. Is there a motion to adjourn this meeting at 11:10 a.m.? Let's stay longer.
So moved, Board Member Kroger.
Thank you. Is there a second?
Second, Board Member Smith.
All right. Board President Joyce, yes. Board Vice President Kirkbride.
Yes.
Board Member Chen.
Yes.
Board Member Hall.
Yes.
Board Member Kroger.
Yes.
Board Member Patel.
Yes.
Board Member Pinedo.
Yes.
Board Member Smith.
Yes.
All right, with that, this meeting adjourned. Thank you, everyone. See you all in a few weeks.
Bye. Thank you.
Yeah.